Welcome to the first of 4 webinars that the National Cannabis Prevention and Information Centre will be hosting in October and November this year. My name is Dion. I'm a research officer here in the clinical training team, and I'll be introducing you to today's presenters. I'll also be moderating question time at the end of the presentation if we get there. So please type through any questions you would like answered, and I'll try and get the presenters to answer them. Today's presentation is titled Very Brief Interventions, and it will be co-facilitated by Jan Copeland, the director here at NCPIC. And she will be talking about the evidence and background behind very brief interventions. Then Nicole Clement, a lecturer here, and Etty Madelon, our clinical training manager, will be discussing how very brief interventions are applied in the community. I hope you enjoy today's presentations. Jan, welcome.
Thank you very much, Dion, and welcome everybody to the second of our series of webinars this year. We like to keep them topical and having feedback in mind and the current work that we're doing at the centre. One of the gaps that we've identified for a long time is that many are willing to do brief interventions, but time is really of an essence. So we're looking today at a very brief intervention, which can be applied in a number of settings, but we'll be talking about its application in the emergency department. Okay. Thank you. Takes a village to get this on the road. Dion has highlighted the overview that I'll be talking about the evidence to support this approach, and Nicole will then talk about the protocol and the preliminary outcomes of the pilot study that we conducted, and then looking at what is the best approach that we can recommend based on the clinical evidence that informed the protocol for this study. So, what indeed is a brief intervention? And Etty will describe in much more detail about how you actually undertake that process. But just so we're on the same page here, a brief intervention is a structured clinical interview which can range from minutes even up to hours, particularly in the US model. It is time limited. It's a patient-centered approach that focuses on behavior change rather than psychoanalysis or any other approach. It's really focused very much on that behavior change, and it's designed for a variety of settings. So, hopefully I'm preaching to the choir here, and that all of you are on board about the importance of addressing cannabis-related issues. But I thought I would just present some of the focused rationale we have for this particular approach. Overall, regular cannabis users are more likely to present to health services with a range of particularly respiratory, cough, wheezing, bronchitis, and cardiovascular problems. A recent study that looked at the evidence found that when they drug tested injured accident and emergency patients, they found that THC was present in 4 to 12% of those with fatal injuries, and ranged from 6 up to 37% of those with non-fatal injuries. Now, of course, the presence of THC doesn't prove impairment in any particular individual case, but it certainly raises the red flag that these are a group that are overrepresented in these kind of accidents, and we should be attending to them more carefully. More than 250,000 Australians use cannabis daily, so the hit rate is pretty good in terms of finding people in your settings that might be using cannabis in problematic